So here we are just going to talk about the postpartum care and its complication. So first of all, what is postpartum, right? Postpartum are the period when the reproductive tract return to the normal and just be a non-pregnant state. So just after delivery of the baby and placenta, the postpartum period start, right? During the postpartum period, basically we have to check the fundal height. In this picture, showing basically height of the pregnant uterus, this picture, and here fundal height is measured centimeter from pubic symphysis to the topmost portion of the uterus. This is the pubic symphysis. When mother going to become pregnant, her height of the uterus is going to increase, and we measure from pubic symphysis towards the umbilicus and towards the Giffroid process, I said. So here in postpartum period, we have to check or measure the fundal height. Basically, after the birth, the fundus should be the firm, and also fundus stay in the midline at the level of umbilicus. After the delivery at 12 hours time, fundus is 1 centimeter above the umbilicus, just 1 centimeter above umbilicus, and fundus is descent 1 to 2 centimeter every 24 hours. At day 6, the fundus is halfway in between umbilicus and pubic symphysis, in between. At the second week, the uterus should not be palpated at all, right? So in postpartum period, basically we have to check or measure the fundal height, and definitely fundal height is going to reduce the size. So fundal assessment is most important. So assess the fundal height, I said. Also uterine placement. Is it in the midline? Is it deviated? And uterine consistency means, is it firm or is it boggy? So every 8 hours we have to check. Definitely during this time, the nursing care is very important. During the assessment, if fundus is displaced laterally, this is the midline towards the umbilicus. If it is displaced laterally, have the patient, you can tell your patient empty the bladder, encouraging voiding every 2 to 3 hours. If fundus is boggy, we have to massage on the fundus in circular motion. NCLEX board sometimes asks this question: if you found the fundus is boggy, what we has to do? Massage the fundus in circular motion. We has to administer oxytocin as prescribed to increase the uterine contraction and prevent the hemorrhages. So oxytocin we give, and the purpose of admin oxytocin are they increase the uterine contraction and prevent hemorrhages. Also, we have to encouraging the breastfeed to stimulate release of oxytocin, right? So what are the physiological change? As we discussed, the size of the uterus rapidly reduce the size, right? And also fundus descent, flaccid fundus, flaccid indicate uterine atony and should be massaged. A tender fundus also indicate infection, right? What next? So after the delivery, the secretion from uterus, this is called Locia. So what is Locia? The discharge from uterus that consists of blood from the vessel of placental site and also cellular debris from decidua, right? Cellular debris from placenta or inner layer of uterus. So the Locia is normal. There are 3 stages of Locia. One is called Locia rubra, Locia serosa, and Locia alba. Locia rubra usually bright red color and last for up to 3 days after delivery. If the Locia rubra more than 3 days, it indicates abnormal. Locia serosa usually pink or brown color and last from 4 days to day 10 after delivery. And alba, it is yellow or white color and last from the day 11 to 8 weeks after delivery, right? Day 11 to 14 postpartum days, and some books say 11 to 8 weeks. So what are the abnormal Locia? So normally the discharge smell like normal menstrual flow. It indicates everything is smooth, everything is good, no infection at all. But during the assessment, we have to check the amount. Also, discharge decrease basically from rubra, serosa, or alba. Day by day, the secretion amount will be decreased, right? And discharge increase with movement. So if excess blood mixed with Locia, this is abnormal. Saturation of a bed within or less than 15 minutes, it indicates the hemorrhage. If the Locia has a odd smell, it indicates the infection, right? So if a mother is passing this postpartum stage, it is very important to educate them and postpartum care for the perineum. So as a nurses, we have to educate to the patient. So we provide the stool softener to prevent constipation. If mother passing this stage, I said, educate the patient about perineal cleaning and use the squeezing bottle of water and also antiseptic solution after voiding. And also tell mother to clean front to back. And let's ask this question: the direction of the cleaning, front to back, and also blot or keep it dry. You can apply the ice pack to the perineum to reduce the pain and reduce edema, and also provide the sit bath twice a day. If mother complain of the pain, we have to provide pain medication as prescribed. Usually, we provide non-steroidal anti-inflammatory medication, opioid analgesic if mother has to go for C-section or topical anesthetics, right? So next here, the physiological change. What are the physiological change take place? So during this stage, so basically the urogenital organ, what are the change place? If we go and talk about the cervix, what change take place in case of the cervix? So basically here, the cervix also involution occur. After a week, the muscle begin to regenerate. So external genital organ like vaginal distension decreased. Ovarian function or menstruation. Ovarian function depends on rapidity with which pituitary function is restored, and menstrual flow resume within 1 to 2 months, and menstrual flow usually resume within 3 to 6 months, and breastfeeding mother may experience amenorrhea during entire period of lactation, means during the lactating time. It is normal, nothing abnormal. So what are the change take place, or how to educate mother about the breast care, and also the what are the change take place during the postpartum care. So basically, the breast continue to secrete colostrum, right? So colostrum is secreted during the pregnancy and for 2 to 3 days immediately after delivery. This colostrum is rich in antibodies, very rich in protein and fat-soluble vitamin. And this is actually gift for the baby from mother because colostrum contained antibody. And milk produce 3 to 5 days after delivery. And patient teaching, what we have to teach, patient teaching, make sure the baby is correctly or take in the part of during the breastfeeding, make sure the baby doing the breastfeeding very correctly. I mean, takes in the part of the areola, not just the tip of the nipple. So we have to educate mother for the breastfeeding. And breastfeeding basically produce oxytocin, which help to contract the uterus and prevent hemorrhage. So postpartum period decrease the estrogen and progesterone level. So these are two most important female hormone. So decrease the estrogen and progesterone level after delivery. Breast become distended with milk on third day. So I said milk produced 3 to 5 days after delivery. The first secretion is the colostrum. Also, engorgement occurred approximately the day 4 in both breastfeeding and non-breastfeeding mothers. Right? So, also, during this time, we have to watch for sign and symptom of mastitis. We have to check the sign and symptom of mastitis, right? So if you ask me what is mastitis, it is actually the inflammation or infection of the breast, right? Usually occur because of Staphylococcus aureus infection. It is important. We have to keep it in mind. So, urinary tract. What are the changes take place in urinary tract? So, urinary tract maybe the urinary retention may have urinary retention because of loss of elasticity, tone, sensation of the bladder from trauma or medication like anesthesia, lack of privacy. So if anybody has to go for anesthesia, the urinary bladder tone is lost elasticity. So retention of urine is most common. Because of retention of urine, sometimes some of the mother develop urinary tract infection. So postpartum hypotonic bladder or urinary catheterization, frequent pelvic examination, C-section, all is important. All is the cause or risk factor of UTI developed. Right? So we have to keep it in mind. Gastrointestinal tract. Usually women feel hunger for after the delivery. Constipation is most common. We have to check for the bowel sound, right? Encouraging or give the food, water, or tell mother for movement, soft or formed the stool. So hemorrhoid are also common in these states, right? Hemorrhoid is common. So even this time is bleeding is common, hemorrhages. Sometimes some complication develop as well. So we have to check the vital sign. What are the data collection? Monitor the vital sign. You know what is vital sign? Blood pressure, pulse rate, respiratory rate, temperature, also to extra pain, another vital sign. So monitor the pain level, monitor for height, consistency, location of the fundus. Is it midline or not? Monitor the color, amount, and order of the locia because it indicates infection. Check the breast for any kind of engorgement, crackle nipples. Monitor for perineum for swelling or discoloration. Monitor for perineal laceration or episiotomy, right? Is it healing or not? Or any sign of inflammation. Also monitor for intake and output. What else? Encouraging the frequent voiding, right? Because if mother do not do this, retention, it causes the urinary tract infection. Monitor for the bowel status. We have to check the bowel sound. Encouraging the movement. Check the extremity for any kind of deep vein thrombosis or phlebitis, right? Postpartum, mother does not move too much, so chance of develop the coagulopathies or chance of develop pulmonary embolism or chance of develop deep vein thrombosis, right? So definitely we have to know what are the signs of deep vein thrombosis or thrombophlebitis, like redness, tenderness, or warm of legs. Usually leg pain also common, and the leg pain is unilateral, sometimes swelling, right? So it is important because to prevent to complication. And also we have to check for RHO immunoglobulin, right? RHO globin. So RHO immunoglobulin is prescribed to administered within 72 hours postpartum to RS negative client who have given a birth RS positive newborn. So if a mother who is RS negative and RS negative mother is delivered a children who is RS positive, that times we has to administer RHOGAM administered within 72 hours of birth to RS negative mother who gave birth to RS positive babies in order to prevent formation of antibodies in mother, right? So here we go. Rubella immunity, rubella vaccine. vaccine is given to patient with titer less than 1:8. Also advise the patient not to get pregnant for at least 1 month. Rubella immunity. Rubella immunity will be evaluated, right? I want to recap it. So vaccine, rubella vaccine is given to the mother with a titer less than 1:8. Advise mother not to get pregnant for at least 1 month, right? Also, we have to monitor for hepatitis B, or we have to monitor for newborn bonding, or monitor for mother emotional status. Very important. So during, we have to, during the discharge, we have to educate the mother, or discharge teaching, how if mother has any breast complication like engorgement or suppression of lactation, everything including during this stage. Postpartum intervention, the client teaching, right? So here, so during this time, we have to teach mother about the mother and infant bonding, advise the sibling adaptation, educate the parents on sibling adaptation. It is very important. Also, we have to find out any sign of impaired bonding. It is important. And if any, we have to educate or intervention. So here, let me show you. Demonstrate the newborn care. Demonstrate the newborn care skills is necessary. Provide the opportunities for mother to birth of newborn. Reinforce instruction to mother regarding feeding technique. Reinforce instruction to mother to avoid heavy lifting for at least 3 weeks. Also instruct to the mother to plan at least 1 rest period per day. So reinforce the instruction to mother that contraception should begin after delivery or with the initiation of intercourse, right? So during the discharge, we have to educate mother about the sexual intercourse and contraception. Both is important because the mother has some misidea about these times, right? As an example, I want to tell you, so like better the postpartum time, avoid the sexual intercourse until vaginal discharge is white or episiotomy is healed around 2 to 4 weeks. Also, physical reaction to the sexual stimulation may be determined for first 3 months after delivery. And also, we have to educate mother about the OCT or lubricant may be needed to prevent discomfort. Ovulation may occur as early as 1 month after delivery, and pregnancy can occur while breastfeeding, right? So we have to discuss with mother, discuss how to use or what use of contraception. It is important. And next here, when enforced instruction to the mother to report immediately if any sign of infection like chill, fever, increased locia, or depressed feeling, right? So postpartum depression is another important note. There's so many parents do not know about this terminology even, right? So we have to educate them about the postpartum depression. So what next? So next is here, um, after the after the pain, oh, we go on. So let me show you. Okay, so we done, fine, teaching. Okay, now here, after birth pain. So what important occur as a result of contraction of the uterus. The nurse should consult with the registered RN or check the healthcare provider's prescription regarding treatment measure for postpartum discomfort, and also perineal discomfort, if have any, we have to apply ice pack to the perineum, right? Because it reduces the swelling, it reduces the pain. After the first 24 hours, apply warm by seat bath, right? It is important. Now go for some important information about episiotomy. So in this picture, you can see this is the birth canal, right? And here the anus. So this and anus, we do not do episiotomy in the midline. We do the like this picture, we do not do. If we do like this, this is actually the fascia. After the healing, the suture material does not heal up or tied up here very good way. The chance of tearing, the chance of scar formation, like this in this picture. So what we have to do, we do the episiotomy little bit lateral. It's called mediolateral episiotomy. So we can avoid the midline episiotomy, right? If we do the midline episiotomy, the birth canal directly communicate with the anus, right? And it takes time to heal up. If you ask me why we do the episiotomy, to facilitate the delivery, because baby's head is big sometimes. When you do episiotomy, it is important, it is easy to deliver. So now go in the note. Episiotomy. Instruct the client to administer perineal care after each voiding. Encouraging use of analgesic. Also admin the analgesia as prescribed to control or comfort and to control the pain and feeling comfort. Also, perineal laceration care is for an episiotomy. Administer the perineal care and use analgesic spray or analgesic for the discomfort, because analgesia reduce the pain, reduce the inflammation, both. So what next? The breast discomfort for engorgement. So encouraging the wearing a supporting cloth all the time, even during the sleep. Encouraging to use the ice pack between feeding, and also encouraging use of warm soap or warm shower before feeding. So how to prevent the constipation? We have to encouraging adequate intake of fluid, encouraging enough fiber containing food, encouraging movement, right? Also, we have to encourage admin stool softener, laxatives, enema, or suppository if needed or as prescribed. So postpartum emotional change. So here the postpartum emotional change. So it is sometimes called postpartum mental health. In this time, it is important to exclude postpartum blues, postpartum depression, and postpartum psychosis. So acknowledge the client feelings and demonstrate the care of attitude. Determine availability of family support. Also encouraging assist the client to verbalize the feelings. Monitor for newborn for appropriate growth and development as expectation. Assist the significant others on others appropriate family members to discuss the feelings and identify where to assist the client. So all clients should be assessed for depression during pregnancy, right? So postpartum phase, it is important to elaborate the mother mental status, because mother think about the baby and also their future, who take care of them, and even they undergo some mental change. Postpartum blue basically lasts less than 10 days, is the depression. Usually the symptom, mother crying, insomnia, decreased appetite, and feelings of let down, and also resolve without any intervention. So if mother develop this sign symptom, what I told you, it less than 10 days after delivery or during postpartum period is called postpartum blue. Another terminology is called postpartum depression. Usually occur within 6 months of delivery. Within 6 months. The symptoms are the persistent feeling of sadness, intense mood switching, sometimes good, sometimes bad, sometimes happy, sometimes unhappy, or crying, lack of appetite, rejection of infant baby, Also, flat affect, anxiety causes panic attack sometime, and typically require intervention. Another terminology related with postpartum emotional change are postpartum psychosis. Postpartum psychosis occur within 2 to 3 weeks. Also, history of bipolar disease is the key risk factor. If mother have a bipolar disease, they have a chance to develop postpartum psychosis. Usually the postpartum psychotic symptoms are confusion, hallucination, delusion, paranoid, or patient and or infant is at risk for the harm, either themselves or mother harm for their children, right? So what next? Nutritional counseling, very important in this stage, nutritional counseling. So discuss the calorie intake for the breastfeeding and non-breastfeeding mother. Nutritional needs depends on pregnancy weight, ideal weight for height, also whether the mother is breastfeed or not. If breastfeed mother, they need to increase the total amount of food. If the mother is breastfed, calorie needs increase approximately 200 to 500 calories per day. And breastfeed intervention, if mother do the giving the breastfeed, what are the intervention we have to do? So put the baby to the mother's breast as soon as the mother's and baby's condition are stable, as soon as, right? Stay with mother each time she nurses until she feels secure and confident with the baby and with her feelings, right? So uterine cramping may occur during the first day after delivery, very as usual. Instruct the client in general hygiene and to wash the breast once daily, right? So also it is important, it is good, should not use the soap on the breast. Also mother should wash the hand before breastfeeding every time, right? And as I told you, they has to wear supporting cloth. Also drink a lot of fluids, apply the breast milk to sore nipple and allowing to air dry, and also report the sign of mastitis to the provider. What are the signs of mastitis? Like sore nipple, cracked nipple, or flu-like symptom. If the engorgement occur, means breast engorgement, empty breast with each feeding, right, until the breast soften, apply the cool compression after feeding, or apply the warm compression or take warm shower prior to breastfeeding. And also some books said, apply the fresh, cold cabbage leaves to the breast. Right? So here, if the crackles nipple developed, expose the nipple to air for 10 to 20 minutes after feeding. What next? Breast may leak between the feedings or during the sexual intercourse or coitus, right? So calories should be increased by 200 to 500 calories per day, and baby stool usually light yellow, seedy, watery. Frequency increase, it is normal. Medication include over-the-counter medication must be avoided, must be, right? Very important, mother must be avoided. Continue. So mother has to avoid the gas producing food, caffeine, or oral contraceptives that contain estrogen and not recommended. If mother develop the cystitis, right? Cystitis, not mastitis. Cystitis means the infection of bladder. So if develop infection of the bladder can occur in the postpartum period, the postpartum women should be encouraging to consume adequate fluid and avoid void frequently to avoid bladder distension. So we have to collect the data and intervention. If anything positive, we have to notify healthcare provider. If cystitis is suspected, obtain the urine specimen for culture and sensitivities. Before start antibiotics. Hematoma. So hematoma actually in postpartum period, sometimes mother develop endometritis, sometimes develop postpartum hemorrhage, sometimes develop coagulopathies, maybe ITP or DIC, all is important. Even sometimes develop deep vein thrombosis in postpartum period. UTI or urinary tract infection is not uncommon. Also have a chance of develop pulmonary embolism, right? So postpartum care is important, and we have to inform mother about all so that mother easily can aware about this. So hematoma, so localized collection of the blood into the tissue that can occur internally, involve the vaginal sulcus or other organ after delivery. So why hematoma? During the delivery, either vaginal delivery or C-section, both cases, mother genital organ has to face with some dealings with instrument, like instrument we use for facilitate the delivery. This is the body or organ, because of dealings with or handling, it is engorged, it is edematous, swelled up. And hematoma formation is nothing abnormal, may be developed, right? So also predisposing condition include operative delivery with forceps or injured blood vessel, and can be life-threatening if not treated. So what are the data we has to know for mother have this abnormally severe pain, pressure feel on perineal area, sensitive bulging mass, mother complaint, or we can uh, found during the examination, or mother complaint inability to void urine, decrease hemoglobin or hematocrit. If anybody hemoglobin is reduced, they also hematocrit level is go down. Even sometime we can see mother has a sign symptom of shock, right? So shock may be hemorrhagic shock because of postpartum hemorrhage. Hemorrhage means bleeding. So if the hemorrhage is not treated, lead to the shock. How do you understand mother have a shock because of pallor, tachycardia, hypotension, right? This is the sign of shock. So if mother develop hematoma, how to take care of them? Monitor the vital sign, right? So if the blood pressure go down, pulse is not palpable, heart rate is too much, tachycardia, sign of shock. Monitor the client for abnormal pain or perineal pressure. Also, place the eyes on hematoma, right? Place eyes on hematoma site. Assist administer painkiller, NSAID, analgesia. Monitor intake and output. Usually input and output should be equal. Encouraging fluid and encourage frequently voiding. Prepare for urinary catheterization if the client is unable to void. So catheterization, another risk factor to develop infection, assist to admin the blood product as prescribed if need. What else? Monitor for the sign of infection. What are the signs? Patient develop fever, means increased temperature, pulse rate increase, white blood cell increase, right? Assist to administer antibiotics, or antibiotics. Prepare the client for incision or evacuate the blood clot or hematoma. Hematoma means blood clot formation, localized collection of blood into the tissue can occur internally involving the vaginal sulcus or other organ after delivery. Another problem is called uterine atony. What it is? A poorly contracted uterus that does not adequately compressed large open the vessel at the placental site. This can result in hemorrhage. Usually, the uterus should be soft or boggy, and definitely if we see the boggy or soft uterus noted on palpation, I mean during the examination, if during the palpation, if we see uterus is soft and boggy, it favor for uterine atony. So if anything like this, we has to massage on the uterus. Empty the women's mother bladder, if that is contribute to the uterine atony. The primary healthcare provider is notified if intervention do not resolve the atony. Hemorrhagic shock, right? So hemorrhagic shock is important. It is sometimes called postpartum hemorrhage. So bleeding occur, bleeding 500 ml or more after delivery. Early sign hemorrhage occur during the first 24 hours after delivery, and late sign hemorrhage occur more than 24 hours after delivery. So if hemorrhage occur before 24 hours, early. If hemorrhage occur after 24 hours, it is late. So what the sign and symptom? What are the data collection and what are the intervention, right? So keep in mind the risk factor of hemorrhage or shock, uterine atony, right? Or precipitous delivery, another risk factor, or laceration or hematoma during the delivery, or use of magnesium sulfate during labor. If you ask me when we use the magnesium sulfate or why we use, because of eclampsia or preeclampsia. Sometimes develop the complication of eclampsia, we has to use mag sulf or magnesium sulfite. Use of magnesium sulfite during the labor increase the risk of postpartum hemorrhage. Also inversion of uterus, another factor. So if I ask you what are the data or sign and symptom of hemorrhage, answer is perineal. If the perineal pad saturation within or less than 15 minutes, it indicates excess bleeding. Blood clot is bigger than a quarter, another cause, another sign symptom. Tachycardia, hypotension, cold, clammy skin, or constant oozing of blood from vagina, or decrease the heart rate or pulse rate. No, decrease the pulse rate. Nursing care. So if anybody, intervention or postpartum hemorrhage, we have to firmly massage on uterus fundus. We have to administration of oxygen, IV fluid or blood as prescribed. Also, we have to elevate the patient legs to increase the venous return, right? Advene oxytocin or misoprostol, they are uterine stimulant. Let me tell you intervention or what are the priority of nursing action or nursing care. One, firmly massage on uterine fundus or admin oxygen, IV fluid or blood as prescribed. Elevate the patient legs to increase the venous return. Also administer oxytocin or misoprostol, they are uterine stimulant. what next? Next is infection, right? So infection may be in the uterus, infection may be in the breast, right? Or it is, if it is breast, I said mastitis. If it is uterus, I said endometriosis. So mastitis, endometriosis, UTI, urinary tract infection, all are infection, right? So any infection of the reproductive organ that occur within 28 days of delivery or abortion, right? Any organ. I said urinary tract infection or UTI infection. Endometriosis means infection of the uterus infection or the breast tissue infection, right? Mastitis, all is the infection of infection. So now has to go the what about here? If the patient had the infection like fever, sign and symptom, fever, chill, anorexia, pelvic discomfort or pain, vaginal discharge that is odd, offensive smell, and normal vaginal discharge has a fleshy water, elevated WBC, neutrophil, increase the temperature more than 100 degree Fahrenheit or 38 degrees Celsius, indicate increase the temperature, right? Within 24 hours of postpartum indicate infection. So what are the intervention, right? So we have to monitor the vital sign and temperature every 2 to 4 hours. Make the mother as comfortable as possible and keep the mother warm. Isolate the baby from the mother. Why? To stop the spread of infection. Provide good nutrition, high calorie, high protein, right? Good nutrition, high calorie, high protein diet. Encouraging enough fluid. How much? 3 liter to 4 liter. 1 liter equal to 1000 ml milliliter. So 3000 to 4000. Encouraging frequent boiling. Monitor the culture. Request if the culture were prescribed. Also assist to administer antibodies as prescribed. So another infection most common is called mastitis, right? So inflammation of the breast as a result of infection or breast infection usually occur because of Staphylococcus aureus bacteria. The primary occur in the breastfeeding mother 2 to 3 weeks after delivery, but may occur at any time during lactation. So what are the risk factors before to go data collection, right? If the lactating duct are blocked, if the nipple trauma from the poor breastfeeding technique, right? Or inadequate hand hygiene, chance of develop mastitis. What are the signs and symptoms like localized heat and swelling, right? So also pain, tender axillary lymph node or elevated temperature, or complain of flu-like symptom. Sometimes mother complain the painful redness, hard area on one breast or two, and flu-like symptom like fever, body ache. Sometimes mother complain fatigue. If you check, we can get elevated white blood cell, right? So what are the intervention? So intervention are administer antibiotics, provide education to the mother. What education? Tell them wash hand before breastfeed. Allow the nipple to air dry, or make sure the infant takes in nipple and areola both, or empty the breast completely with each feeding. And breastfeed frequently, it is also important. Use the breast pump if the breastfeeding is too painful to empty the breast. Very important to intervention for mastitis, right? Even they said admin analgesic for the pain, encouraging mother to support the breast with supportive or enough good fitting dress, encouraging the manual expression, maintain lactation in breastfeeding mother, apply heat or cold. Another one is called endometritis. What it is? Infection of the lining of uterus occurring in postpartum period and caused by bacteria that invade the uterus at a placental site. The infection may spread, involve the entire endometrium, and cause of peritonitis or pelvic thrombophlebitis, right? So endometriosis, what it is? Infection of uterus. What are the risk factors? If mother have a C-section or cesarean section, retain placental fragmentation inside the uterus even after delivery, prolonged rupture of membrane or chorioamnionitis, or internal fetal uterine monitoring is all of the cause of the risk factor to develop endometritis. What are the data collection or sign and symptom? Sometimes mother complain of pain, flu-like symptom like fever, body ache, malaise, tachycardia, excessive or word offensive locia, elevated WBC. Sometimes mother said headache or backache. So continuation data, prolonged severe after pain, tender large uterus. What are the intervention? So monitor vital sign, place the mother in polar posture and provide private room. So also we have to collect the vaginal or blood culture, right, before start antibiotic. Admin IV antibiotic and analgesic for as ordered. Also, educate patient on importance of good hand hygiene. Very important to prevent the endometritis. What next? So they said, inform the mother that it is not necessary to isolate the newborn from the mother. Instruct the mother in proper hand hygiene, initiate the contract precursor, initiate, monitor import and output, encouraging enough fluid, intervention, intravenous, IV antibiotics, rapidly work, administer comfort measure, right? Also, oxytocin medication may be prescribed, improve the uterine tone. Another complication is called pulmonary embolism. Sometimes the complication co-occur during the postpartum period. Yeah. So pulmonary embolism, the passage of a thrombus, often originating in a uterus or other pelvic vein, into the lungs, where it disrupted the circulation of the blood. So pulmonary embolism, basically complication of deep vein thrombosis, right? I said pulmonary embolism are the complication of deep vein thrombosis where the embolus moved into the pulmonary vasculature or occurring the vessel and obstruction the blood flow to the lungs. Very important. What are the data? Sometimes sudden dyspnea or chest pain, tachycardia or tachypnea or tachycardia. So heart rate increase, pulse rate increase, right? Sometimes patient complain cough. Hemoptysis means blood mixed with cough or feeling of impending doom. So what are the sign symptoms? Some mothers said dyspnea, chest pain, right? Tachycardia, hypotension, hypoxia means oxygen reduced, peripheral edema developed, blood sputum, which is called hemoptysis, right? What are the intervention? What are the intervention if mother developed the pulmonary embolism? Admin oxygen, also position the client with head of the bed elevated, monitor the vital sign frequently, monitor the sign of respiratory distress, assist the administer intravenous fluid, and prepare to assist the RN or healthcare provider to admin medication, dissolve the clot, right? So if I make a summary, the treatment or intervention, first of all, place the patient in semipolar position, semipolar. Then give oxygen, position, oxygen, administer oxygen. Administered thrombolytic medication as prescribed, like alteplate or streptokinase also implement the bleeding precursor, right? It is important for our board exam. So, as I told you, the pulmonary embolism are the complication of deep vein thrombosis. If you join in my other class, especially the adult health, I will explain more about deep vein thrombosis, but something is important I want to share with you here. The deep vein thrombosis, basically the patient complain about the unilateral leg pain or swelling or worm or redness. If you see your patient have a deep vein thrombosis, it is good to take the intervention to prevent the deep vein thrombosis complication. What are the prevention measures? So we has to ambulate early and frequently, means encouraging your patient for movement, avoid prolonged immobilities, or elevate the leg when sitting, or avoid the crossing legs, or drink 2 to 3 liters of fluid per day. No smoking, and also better encouraging them to wear anti-embolic stocking, right? So if your patient have a deep vein thrombosis, you have to encouraging them for bed rest, elevate the affected extremity above the heart, no pillow or knee guard under the knee. Apply the warm, moist compression, but never massage on the leg, right? Also admin analgesia, anticoagulant like heparin, warfarin, or better to implement the bleeding precursor. Another word is here we are going to talk is called sub-invulsion. If the incomplete invulsion or failure of the uterus to return to its normal size or condition, this is called sub-invulsion. What are the sign symptoms? Uterine pain, or uterus is larger than expected, or more than normal vaginal bleeding. So intervention, monitor the vital sign, check the uterus and fundus. Also monitor for uterine pain or vaginal bleeding. Elevate the leg to promote the venous return. Current frequent voiding. Monitor the hemoglobin and hematocrit, right? Another problem, it is called thrombophlebitis. So thrombophlebitis, what it is? So thrombophlebitis means a condition in which a clot forms in the vessel wall as a result of inflammation of the vessel wall. Maybe the partial obstruction of the vessel or increase the blood clot factor. So early movement in the postpartum period after C-section is the prevent preventive action to develop thrombophlebitis. What are the intervention, right? So specific therapies may depends on location of the thrombophlebitis, monitor bed rest, elevate the affected leg, apply the now also it is important like the DBT, never massage on the leg, and monitor for manifestation of pulmonary embolism. Apply the hot pack or moist heat on the affected side. Apply elastic stroking or support hose. Assist to admin analgesic and antibodies as prescribed. Also, intravenous heparin sodium can help. So it is very important. Other one is if mother lost the baby, is called prenatal loss. So prenatal loss is associated with miscarriage or neonate death or stillbirth or therapeutic abortion, right? If mother lost the baby, definitely they need a counseling, mental support, and also spiritual support, right? And one question is here, before to finish this PowerPoint, they said a postpartum mother, postpartum client is getting ready for discharge. If the nurse is suspect that the client need further teaching related to the breastfeed when she makes which statement. Further need of teaching means mother or teaching something wrong, you have to correct, right? So something wrong, you have to correct. So this need further teaching. So out of this, I said I do not need the birth control because I will be breastfeed. I need to increase my calorie intake. Yes, it is very important. I should not use soap to wash. Yes, it is right. I need to be sure that I am increase my fluid intake. Yes, it is right. Only one wrong. That I do not need birth control, right, during the pregnancy. So the RN or LPN need to teach them. If anybody tell that I do not need to birth control because I will be breastfeeding.